is wound care. So, care of open wound, decubitus ulcers, and burns to promote healing and prevent further injury or deterioration of the wound. So, for the purpose, to promote healing and prevent further injury or deterioration of the wound. So, for the materials or equipment, we have the dressing materials like gauze, pads, plaster or tapes, then Penrose drains if necessary, then antiseptic solution if needed, then sterile corset, sterile kidney basin, scissor, cotton flagets, and safety pins. And also we have the sterile gloves, then the specimen slides like oil specimen if needed for obtaining specimen. And last we have the waste receptacle. So for the assessment, we need to check the doctor's order, check the client's dressing, and we need to check the client's unit for supplies. So for the planning, we need to wash our hand and prepare the environment and gather materials or equipment that is needed. Implementation, we need to identify the client and explain the procedure, and then we need to remove the plaster and dressing and drape the client if necessary. Then observe the wound, then we need to wash our hand and then open the sterile pack, observing a septic technique. And then we need to pour the solution on the kidney basin and then put on the sterile gloves and then clean wound with the antiseptic solution and then apply dressing and plaster. And then we need to remove the gloves and place it in appropriate waste receptacle. Then assist the client to a comfortable position, and then we need to do a aftercare. I'm going to remove the plaster and the dressing of the patient.
Wash hand. Open the sterile pack and observe the aseptic technique.
I'm going to pour now my solution in the kidney basin. And I'm going to put now the sterile gloves. I'm going to clean the wound with the antiseptic solution. I'm going to apply now the plaster and the dressing to my patient wound. I'm going to remove now my sterile gloves and I'm going to put this on the waste receptacle. For the evaluation, we need to evaluate the nature of the wound and then evaluate the effectiveness of the procedure. So for the documentation, we need to record the procedure done and the reaction of the patient. And then we need to record also any unusual observation on the wound.